Thank you for joining us today on SeniorLivingGuide.com podcast station. I'm Darlene. I am your host with SeniorLivingGuide.com. Does the idea of searching for senior housing solutions seem overwhelming and you just aren't sure even where to begin? I have great news for you today. We offer a one-stop solution to take the stress out of your senior housing search. SeniorLivingGuide.com is created to make your senior housing search quite easy to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and even home health solutions, all on one website, allowing you to decide which best fits your needs and connecting you directly with those communities. So visit us online today and start de-stressing. And we have some amazing guests in our studio today, and we're going to talk about diagnosing dementia. And today we have our guests, Dr. Pam Tronetti and Janet Rooks. Dr. Tronetti is an osteopathic physician who specializes in geriatrics. Janet Rooks is a social worker and a dementia care specialist. They work together at the Parrish Senior Consultation, where they focus on the care of patients with dementia. Dr. Tronetti is the Director of Aging Services at Parrish, and Janet Rooks coordinates Parrish Senior Solutions, which provides education, resources, and support for seniors and their caregivers. So to kind of get started on dementia, so what is dementia?
Well, dementia is an umbrella term.
Okay.
It encompasses all types of memory loss.
Mm-hmm.
It's not a diagnosis, it's a condition. So when we think about dementia, it's a process. It's memory loss.
Mm-hmm.
It's the process and personality changes. So it impairs reasoning.
Okay.
People will call and say, well, I'm glad they don't have Alzheimer's, they just have dementia. I'm glad they don't have, they're just forgetful, that they've got some dementia.
Mm-hmm.
So it affects the ability to live independently and to function independently.
Mm-hmm.
There's approximately about 50 different types of dementia.
Yeah, I've heard that before, and I find that just, I don't want to say shocking, but just super surprising that there's so many different types.
It's kind of mind-boggling, if you will.
Absolutely.
Yeah. And people will come in and say, my loved one has dementia. Well, what kind? They'll say, well, what are you talking about? I don't know.
Mm-hmm. Yeah, definitely. So what's the difference between dementia and Alzheimer's? Because if you're saying that people are, I don't want to say grateful per se, but if they have dementia and they're happy that they don't have the Alzheimer's, what's the difference?
Yeah, because they'll say, is it just dementia? Now, of the 50 different types of dementia in the United States, 50 to 60% are Alzheimer's disease.
Okay.
That is Alzheimer's dementia. That is the type of dementia that they have.
Okay.
The second most common is vascular dementia. That's 30 to 40%, and it's from tiny mini strokes that robs people of their memories and abilities. So if you're doing the math, heck, that's 80 to 90%
Right.
of all the dementias. And then there's another 10% of more rare types of dementia that we do see, but maybe we see it once a year instead of once a week. And the dementia progresses differently, and there's different hallmark symptoms for each one. So that's why we want to get that exact diagnosis. And there ain't no law that only one thing can go wrong at a time. So you can have a combination, a mixed dementia, vascular and Alzheimer's.
When people think of a stroke, they think of something that, someone may be paralyzed on one side, but there are those, as you mentioned, the little mini strokes that take someone's memory.
Right. In your brain. I always want to clarify the brain. So what are some warning signs of dementia?
Well, there's the difficulty in the complex tasks like the bills and the pills. They just can't do it anymore. The bills get piled up, the utilities get turned off, so just the difficulty with those complex tasks. And you say, well, there's not a lot to taking your pills? Oh, yes, they are. When you're taking a lot of pills, that includes the supplements. And, well, I've had people say, well, I just turn the bottle upside down when I take it. Oh, no. So that difficulty with the complex task.
Yeah. My dad, we've talked about this. My dad had dementia. He started placing sticky notes on when he's supposed to take them. Well, the sticky notes don't stay sticky for long.
No.
So it became like this hot mess. But he was refusing to do, the little pill cases because that meant he was old in his mind. But he was absolutely refusing. So it was really hard to try to organize the pills.
Yeah, and they also get overwhelmed or underwhelmed with just the things they need to do. And it may be just daily task, doing laundry, making the bed, just things that you and I, we just automatically do.
Right.
But someone that has dementia, they're sleeping on the couch because the bedroom they can't get to it for the stuff that's piled in there. So just the daily tasks, they get overwhelmed or underwhelmed with it.
Yeah, things are half done. They're doing the laundry, but are they really adding the soap? Well, oh no, they're still dusting. Well, are they dusting the whole shelf or just the top shelf? Are they washing the dishes again with soap? There's all these little subtle things that usually it's just people who are close will notice these things.
I've heard you tell the story about the gentleman you had when you were up north, that he would carry he kept the jug of gas in the front of his car because he kept running out because of the fact. So that was his way of solving his problem. So just keeping gas in the car.
Oh, wow. That sounds like a bad idea.
Yeah, and it was.
Yeah.
So it's the judgment as well as the forgetting how to do things. It's making the wrong choice to fix a problem.
And also there's the repetition, just, telling the same thing over and over. Family members may call, how are you doing today, Mom? I'm good. I'm fine. Fine is a 4-letter word. I'm fine. But, the repetition, making toast, making a cup of hot tea, drinking the coffee, just, everything. The grocery list, making buying the same thing at the grocery store every time they go.
Or buying more than what you need.
Absolutely.
Overbuying.
Buying coffee every time you go.
When you already have a lot of coffee.
Exactly. Or family or friends have noticed and voiced concerns. They may call the children or may say, oh, well, you've told me that a dozen times. No, I didn't. No, I didn't. And then you get angry. So that's when there's
Yeah, and we're not talking about tell us a story about when you were fishing and you fell off the pier. It's more like, Dad, I told you 3 times you had to be ready to go to the doctor at 10 o'clock. Or Dad, you told me 4 times that we're out of milk and we have to go get milk. You already told me that. And it's within minutes, within hours.
Yeah. No, I agree with that. And I think that sometimes, we do that naturally, but I think you have to really keep an eye out for the continual, not storytelling, but the reminders and things like that for sure. So what are some other things as far as, when they become overwhelmed, I think, do they ever kind of experience in the being overwhelmed? Does their attitude kind of change in the way that they express the overwhelm? Is that a specific sign? Do you know what I'm saying?
Well, there's all kinds of different responses. For some folks, they're not overwhelmed because they don't have the insight to know that anything's wrong. Oh yeah, I'm going to get to those bills tomorrow. Oh yeah, I pay my bills every month, and they're due, so I'm gonna get to that. But other times it's the writing lists, writing notes, and then you have pocketfuls of little notes and notes all over the house because they're trying to keep a hold.
Trying so hard. Yeah, even, my dad had dementia. And one thing that I noticed when I would go over there is the whole dining room table he had organized with trying to keep it super organized, but yet it was just kind of a hot mess. And I had never really seen him do that before. but it also gave me an insight as to what kind of bills he had. So I really did start having the opportunity to kind of peek through them when he wasn't really looking and seeing what are these bills? Who is he paying? And seeing that he did have probably bills that he really shouldn't, like multiple bills to more than one cell phone company,
Yeah, exactly.
more than one
that.
cable company. Why do you have more than one cell phone, Dad? Didn't realize he did. More than one cable company. And even, I know we've talked about this in the past in our scam, Don't Get Scammed, where he was paying an attorney that was not an attorney. I'm not sure who it was. So I
refer to that as organized chaos.
Yes, yes. So a little bit of a hot mess there. So I think that makes a difference. So, one thing that I did want to ask you about as far as dementia, and this is something I kind of learned, everybody I think kind of assumes that memory loss is a sign of dementia, but there's a lot of different things that also go along with that.
It's most people can deal with, okay, Mom forgot how to do this task. It's the behavior. It's, I did not lose my wallet. Somebody's coming in at night and they're hiding it. You're the one who took my scarf. I know it was hanging right here. So you must have come in and took it. It's paranoia. It's accusations. It's a lack of a filter. Right. That you just say whatever's on your mind comes out your mouth, whether it's real, true, imagined. And there's a personality change. A lot of times the sweet, nice person is now, swearing and yelling. And it's just like people, that's not my mom.
Right.
That's just not my mom. I need you to help me get my mom back.
Right. Like when your dad or loved one calls you and says, the neighbor's done this, the neighbor's done that, and you're going, what? And you think it sounds bizarre and strange, that's a red flag. Because there's a potential that it's not really happening. So
and we see it more than you would imagine, which, our patients all have dementia by and large, for the most part. And, they have put things away because it's important. And we will actually demonstrate to the family of taking this piece of paper, putting it under the pillow. This is important. I'm going to put this away. And then I'll look at the family member. You stole that. You took my piece of paper. I know you did. And it's almost like their light bulb just comes on. You can just see it. And it's like, I never thought about that. But you're the only one that's been in the house. So, of course, you're the one that's responsible for this.
Right.
And it's so sad.
Right.
Yeah. And the family tries to use logic. They try to explain, or they ask why. Why did you put your purse in the washing machine? The answer is either going to be, I don't know, or it's going to be, well, somebody might steal it. Therefore, my solution to that was putting it in the washing machine. Buying things. My favorite is a lady who lives in an apartment and she buys a trampoline. Because she saw it on TV and if the grandkids ever come over, they might want to jump on the trampoline. So I bought this. Grandchildren might be in college.
Right.
But again, that kind of logic.
Right.
And you can explain, you can talk, you can try, but it's not going to sink in.
Huge red flag. And as I know we've talked before, as a caregiver or as a family member, it's really, really hard. You definitely, when you're talking to them, you really want to find the excuse as to the logic, because it's very hard to acknowledge that your mom or dad or your loved one is having dementia, because you do think it's a memory loss. You do think that maybe they don't recognize you, because that's one of the first things you think, well, they recognize me. They know who I am. They know their favorite waitress. They know where they're going to go eat. They know how to get to the store. They know all these different things. So it can't be. So you want to give them that, I want to call it like a get out of jail free card.
Yeah.
And that's just, unfortunately, disheartedly, it is not the reality. And it is really hard to kind of step back and accept it and really start acknowledging that, I think. So,
but have you ridden with them in the car to get to the grocery store? Which route did they take? How long does it take them to get to the grocery store?
Right.
How long does it take them to get through the grocery store? Are they struggling with the things that you just mentioned?
Right.
It's almost like you have to put your love on the shelf you have to put your role as a daughter or granddaughter, spouse or whomever, and it may not be you that has to step in. It may be another family member to step in and say, hey, you know, there's some struggling going on here. You deserve an evaluation. They deserve an evaluation.
Yeah, and we use the word struggling. Are they struggling with the remote? Or are they saying, you know, this thing is broken?
Right.
You know, they've broken or they've had 3 broken phones.
Right.
It's just that they can't get them to work. They can't do the things that they used to do.
Yeah.
Yeah. I know that my dad had called me and said, there's something wrong with my phone, and I got a new phone and a new phone number. And I took it as that. And the reality is when I eventually found out, he actually still had the other phone, was paying on it, and there was nothing wrong with it. I don't know, because he didn't really know how to explain it to me at the end of the day. And, you know, even when he was experiencing some of these things, I was trying to kind of dig a little bit to see if he realized he was having these issues. So do some of these patients, or do they know that they have dementia? Do you think that they understand kind of what's happening?
Sometimes early on, they'll know that something's just not right. But as they get further into the memory loss, the dementia, a lot of times they don't. I've seen Dr. Pam say, you know, you have Alzheimer's. The family's sitting there, just tears running down their cheek. I mean, they are heartbroken. The patient will say, okay, is there a pill? I want a pill.
Yeah.
Or nothing. I mean, they're just moving on. Can I go? You know, what else is going on? And it's like such acceptance. And the daughter's just sitting there, just white, tears running down the cheek, holding their breath, because they're petrified of what the future holds.
There's a disconnect.
There's a total disconnect.
And maybe that's a complete blessing.
And you know, and then other times it's like, I do not. They're crossing their arms over their chest. I do not. I'm going home. I'm never coming back here.
Yeah.
But then when the follow-up appointment, they have no memory of anything being said.
Yes.
You know.
Which was my experience.
Yeah. So it's a 50-50 or a flip of a coin. You never know.
I'm going to say, just unscientifically, probably 80% of our patients have no insight that anything's wrong. Maybe another 20% are in pain and depressed, and they know that something is wrong, and they are very worried about what's coming.
I guess the term that I think of is agony. They are in just such agony that they can't do what they used to do. There's just, you know, and it comes out in behaviors, you know, depression, and then also acting out. We get a lot of people acting out.
Yes.
Yep. And you use the word disconnect, because down in Florida, we have what I call the disconnected elderly. They moved down here when they were 65, and now they're 85. And the neighbors are concerned, the pastor's concerned, the landlord's concerned. But the family calls, and they say, so, Dad, how's it going? Oh, fine. How's the weather down there? Is it hot? Yeah, it sure is. Hey, how about that football game last weekend? Oh, that was really something. And they go, see, nothing's wrong.
Nothing's wrong. Yeah.
It takes somebody standing next to the person and noticing, hey, they haven't clipped their toenails in 6 months. Hey, these are empty pill bottles. Hey, they're not eating properly. They're forgetting how to put together a meal. You need the hands on, the eyes on, to clearly see.
Or they have
that
500.
something's wrong.
Or they have 500 highlighters in the house that they don't use.
And sometimes the siblings, you'll have a child here, and they see how things are going. But the child that lives out of state, the same conversation that Dr. Pam was talking about. And so it's like, Janet, can you talk to my brother? Can we have a little family meeting and you discuss what happened at the last visit? Because my brother's just not accepting this at all.
Right.
And he'll come into town. It's like, no. And it's back to the arms crossed over the chest.
Right.
And he'll spend a weekend, come down for the weekend, but he's hanging out with his buddies. He'll spend a couple of, may take Dad out to eat, and that be it. And so it's a difficult situation sometimes until it gets really bad.
Right. I think it's very difficult for families, or I know, to look at your loved one, and it is really hard to accept that it is happening. You will deny it. I mean, I did that. I absolutely denied it was happening.
Out of respect, out of love, out of this can't be, because my dad was a college professor. My dad was in the space program. it can't possibly happen to him.
Exactly. You really just, it is very difficult to acknowledge because you just know that once it starts, there's no going back, Suze. Yeah, exactly. What do you do if you suspect this is happening to someone that you love?
I actually like families to write down symptoms. Folks will come in with 4 pages. They're painting the picture of what happened, because many times they go to the family doctor and they'll say something's wrong with mom or dad. They're given a memory test, which they ace because it's pen and paper. But meanwhile, they're not doing their laundry, they're not eating properly, they're confused and disoriented. But the family's saying the dog doesn't go outside anymore, the place smells of urine, the food is moldy in the refrigerator. They paint the picture for us. So write it down. It also makes it more real for you.
Yes.
That, okay, something's wrong.
The buying of puppy pads is a huge clue when your dog was being taken out. I will tell you that. Yeah, for sure.
I would not have thought of that, but you have a point.
That was happening with my dad. The dog would be taken out every day, to go outside, to go to the bathroom, and then all of a sudden he started choosing to use puppy pads versus taking the dog out. Yeah. And I thought that was very odd.
And so and you get the right diagnosis from the right kind of specialist, a neurologist, a geriatrician, or a good family doc who's going to take the time, who says, you know what, I've taken care of your mom or dad or loved one for 10 years, and we're worried. My staff is worried. They're showing up on the wrong day for an appointment. Let me do what I can to evaluate this, and then maybe I'll call for help from another specialist.
Right.
But at least they'll get the ball rolling.
Yeah. Yeah, exactly. So I think we're going to talk about a little bit more about what to do when you suspect someone, and then also a typical workup for that when we come back from our break.
That went quick.
Parrish Healthcare, we believe in our community. We believe in keeping our community safe. We believe in the art of healing. We believe in healing patients, healing families, healing communities. We believe in the best and brightest working together for the common good. At Parrish Healthcare, our team focuses on you as an individual because every life is a work of art to us. Parrish Healthcare, where the art of healing comes to life. Visit parrishhealthcare.com/healthaware for a free health risk assessment.
Hey, Mom, how's the retirement home search coming?
Oh, my gosh. I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in like one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com and start your search today and start de-stressing.
At Parrish Healthcare, we believe every life is poetry in motion, motivated by strength and determination. As your bone, muscle, and joint healthcare partners, we believe in blending the art of healing with the science of medicine to keep your body in motion. We believe in healing patients, healing families, and healing communities. For a free orthopedic health assessment, visit parrishhealthcare.com/orthoaware. Parrish Healthcare, where the art of healing comes to life.
Welcome back, everyone. We are talking about dementia and just knowing what to do if you suspect that someone that has it, and some different ways to get it diagnosed so that you can start some treatment on it. So as far as doing, you talked about documenting it, and then what would you do? Would you take it to a physician to get a physical exam?
Yeah, you start with the basics. The physician needs to sit and listen and go over what medicines are you on, what other medical problems do you have, because maybe it's not dementia. Over the years, we've had people that thought they had Alzheimer's. It was hearing loss. It was just they weren't hearing, Dad, I'm going to pick you up tomorrow at noon. They had sleep apnea. They had a side effect from a medication. They had depression. And there were different treatments that the problem masqueraded as dementia, but we treated the other problem and things got better.
So I have a question, and this is just off the cuff. I understand that potentially UTI can also masquerade. Is that, or is that not correct?
You're close.
Yeah. Okay.
What happens is a urinary tract infection causes delirium, acute confusion, and being mixed up. The people that happens to often have an underlying dementia that they're holding on, and then they get sick, and it just throws them for a loop.
Okay.
So if it's just periodic, every time Mom gets dementia, a UTI, she gets confused. You still bring them in to make sure, well, is it a medication? Is it dementia? And then we have to treat the UTIs, and that'll take away one other causative factor.
Okay. Super interesting, because I did not know that. I thought that would be kind of interesting that would cause that without having an underlying, but that makes complete sense. Yeah. So, and educating yourself, really kind of digging deep, because I know that it's so weird, because I thought I was pretty educated until it happened to me. And then I realized I was so completely uneducated. It does really make a difference to really just ask a lot of questions as a caregiver, and just become really educated on what to expect, and so that you can be your best self for that person, and then be your best self for yourself, because that's super important as well.
Yeah, we recommend the book, The 36-Hour Day.
Okay.
It's a phenomenal book. It's from nuts to bolts and everything for caregivers. But be careful on the internet. There's a lot of good false information out there, and I know that's an oxymoron, saying a lot of good false information, but there is.
The internet's very well known for a lot of good false information.
It really is. So, go on some reputable sites to get good information.
Okay.
Because you're only as good as the information that you know. I mentioned the 36-Hour Day, but there's also some really good books out there that are tried and true. Biographies, stories, books where someone has cared for someone with dementia. They'll pull on your heartstrings, but they're really good books.
And caregivers.org, I believe, is a really good resource. Alzheimer's.org.
Yes.
Those are great.
Yeah. Alzheimer's Association has some, and there's some good chat rooms out there as well. And you'll learn a whole lot. Right now, a lot of the caregiver support groups are on hold because of the pandemic. But
now, I do know some of the chapters in some areas are doing, they're doing some Zooms.
Yeah, they
so
are.
it's just looking for those. And I know our website, we do post those on our events page. So if anyone's looking for those, you can find those on our events page. And we do those across the nation. So if you're looking, then they might be located on there.
Fantastic.
So what would a typical workup look like?
After looking at the medications and the lifestyles, this person smoking and drinking, are they doing abusing any drugs? Then we would do a physical exam to see, does it look like they've had strokes? Does it look like they have Parkinson's disease? Blood work, liver, kidney, sugar, blood count, thyroid, B12, vitamin D, brain imaging. I like an MRI.
Yes.
Better picture than a CAT scan. Sorry, CAT scanners. Often we'll do a sleep study.
Interesting.
Because sleep apnea can cause that fogginess during the day. And again, you can have Alzheimer's disease, B12 deficiency, and sleep apnea all at the same time. Now, there if we see people in their 40s, 50s, 60s, we often take it one step further. We're doing spinal taps. We're doing more extensive blood work. But that's the general basic workup that you should expect to have done.
Also, she's going to look at any toxins that may be going into the body. She mentioned drugs. Alcohol can mask dementia. And I've heard her say, anytime anyone's on alcohol, drinking alcohol, one alcoholic beverage in someone over the age of 65 is equivalent to 3, and what it does to the brain and how the body metabolizes it. So she's going to ask them not to drink anymore. And it's amazing how sometimes it will clear up.
Wow.
But sometimes the damage is already done.
Yeah.
But there may be the clearing up.
Yeah.
Sometimes the personality, they're just eccentric. They really are, let's just face it.
Yes.
But we're also seeing some disorders, personality disorders and that sort of thing. So you can't change who that person is. Sometimes they just become more of who they are. So if we're just seeing more and more of that. And so it's really interesting. I wouldn't change my job at all because it's just like you just peel the layers off and it just, but
Like
that's
an onion.
like an onion.
Yeah.
And sometimes you cry.
Yeah. Sometimes you cry.
Yeah. So I'm noticing you mentioned the B12. So what does that have anything to do?
Vitamin B12 is crucial for nerve function, for mood, and for memory. And
Did not know that. Okay, interesting.
And as we get older, sometimes we don't absorb vitamins like we used to. So they're taking a B complex vitamin, but we draw a B12 level, and it is low or even in the low normal range, and we end up giving the B12 shots. And the person has more energy, they feel better, they're walking better, they're talking better.
Right.
It's a win-win.
Yeah, I always thought B12 was just for energy. I never realized it was for anything other than just like to promote energy and increase metabolism, which is clearly a bonus. So
it's important for blood development too, so you can have anemia from B12 deficiency, but you also have the memory loss. 100 years ago, they called it megaloblastic madness because the red blood cells were big, but they were pale. They were megalocyte. Yes. I love the history of medicine. Sorry.
No, I'm learning so much because that was something I absolutely did not know. That's very interesting. So, what kind of testing is done? Is there lab work done? Oh, you do we just talked about that. I'm so sorry. So what are the chances?
We do memory testing too, by the way.
So do you do, when you do some of these memory testing, do you do, like I know that one of the very first things that my dad did was they asked him to draw a clock, which he wasn't really able to do. They asked him who the president was. He didn't, and then he got mad because they were asking him, like he felt like he was being
interrogated.
Yeah, and like, well, why wouldn't I know who the president is? Of course I know who the president is, but then he couldn't tell him. He couldn't say. Yeah, so it was very interesting. He got very
very defensive.
Very,
and
very
we
defensive.
Have people, well, you know, I know what day today is, but I usually would because I read the paper every day, but I was rushing to get here. So I didn't read the paper. If I had, then I could tell you what the day and the date is.
Yeah. So those things that you would typically do before an MRI? You would just would that be like your baseline?
It's all part of the visit to see where they're at. And we do a 30-question memory test, have people name as many animals as they can in 1 minute. We do something called trails, which is called kind of a connect the dot, and it's timed. And sometimes we will order what's called a neuropsych test. It's a psychologist. It's like a 3-hour intelligence test, basically, that can tease out what areas of the brain are affected. Is this more like Alzheimer's? Is there a lot of depression, anxiety?
Yeah, and it's a lot of times it's those individuals that are having problems and just starting to have the problems.
Okay. So what are the risks of developing Alzheimer's?
You mean Like, what are your chances, or are there risk factors?
Like the lifetime risk. I mean, for like, if you're going to Vegas, what kind of risks? I know, because everyone kind of has that in the back of their mind.
And you know, it's individualized, but it's also general. If we took 1,000 45-year-olds and followed them, 10% of the men and 20% of the women would develop Alzheimer's in general. Why are there more women? Some of it has to do with they're just living longer. And as you get older, that increases your risk. So if you have a bunch of 85-year-olds, it's going to be closer to a 50% chance of having the Alzheimer's rather than the 10 or 20% looking into your future chance.
So what about genetics? What kind of role does that play? Because I know that that's clearly one that they've talked about more and more. If you have someone that's in your family that's had it, or your parent that's had it, that you may be more likely to have it?
Yeah, if you're one of your parent has it, yes, that increases the risk. If a brother or sister has it, that's an even higher risk.
So is there testing, or exactly how does that work?
You know, they're still in the research phase, so there's no blood tests that we can get right now routinely to do that. But you'll read a lot, and you'll see on some of the, check your DNA websites, apolipoprotein E, and it's APO, A-P-O-E.
Okay.
And there's basically 2, 3, and 4. The easiest way I have to make this understood is to pretend you're rolling the dice.
Okay.
Because you're going to have 2 of each of one of these 3 different genes. So here you are rolling 2 dice. If you get 2 2s, the lower the number, the lower your chance. If you roll 2 3s, that's average. So your average risk, you're 45, women 20%, men 10%. If you have 2 of the 4, the ApoE4, much higher risk, 3 to 5 times normal. So you can look at these, you can have them tested, but it's not 100%. You could say, oh, I know my risk is higher, therefore I'm going to do things to prevent this. Just like genetically, some people are prone to emphysema. So if you know that, you know not to smoke. And you know not to get a job where you're exposed to fumes. So if you know, oh, I'm at higher risk for Alzheimer's, maybe I should start now to do all the good preventative things, get enough rest, eat healthy, exercise regularly, those things that are going to decrease risk.
All those things that we talked about
at every show.
Yes. Eating healthy, eating, exercising, getting, fresh air, sleeping well, making sure you have B12, like we just talked about, would be really important. Not the anti-inflammatory
a low inflammation diet,
low inflammation, Mediterranean
Mediterranean
diet. So Google Mediterranean diet, and just kind of focus a little bit more on that to kind of help with that if you feel like you would be, I guess, at risk. Is that basically so that's really interesting. So if you wanted to get a test to see, do you recommend people getting tested? I mean, just out of curiosity, or do you think it's, what are your thoughts?
That's one of the most controversial topics right now, because some people say, why even find out if you're going to just lay awake at night worrying, oh gosh, I have a slightly higher risk than other people. If you have your genetics out there, will somebody say, well, I don't want to hire this person because they're going to have this medical problem later? I can only tell you that that's not in doctors' offices, routine practice. It's not something we do. Again, because it doesn't give a diagnosis. We do testing that will give us a diagnosis.
What I can say is people will call the office and say, I'm struggling with the things I've talked about before, the bill paying. It's interrupting my daily life. I'm missing appointments. My family's noticed. Friends have noticed. If that's happening in your life, you deserve an evaluation. You deserve, to be seen, to get that check. I can say yes. Call, talk to your family doctor, talk to somebody, and get an evaluation, a baseline to see if you do have problems. It could be the things that Dr. Pam talked about. It could be a side effect of a medication. It could be that you're having that nightcap and it's interfering with your sleep, and interfering with your sleep is causing you to have memory loss. You're dozing off, this sort of thing. Sleep apnea. You deserve an evaluation for a baseline.
Yeah.
So, if you are having problems, other people have noticed it. But if it's just that you've got a family history, you've got your grandmother had dementia, you've got your aunt had it, I don't know.
I love the fact that you're able to do such a thorough workup, because I'm not sure that that's always available everywhere, to have such a thorough workup from A to Z, to kind of rule everything out and then make sure that you get a proper diagnosis as well. I mean, it's truly a great thing that you're able to do that.
We are. Our first appointments are an hour long. If you have this kind of concern, to me, a diagnosis of dementia is so life-changing. Call your doctor's office and say, you know what? This is going to take an extra long visit, so they don't put you in as if you had a cold. And you might say, can I drop some information off ahead of time for you to look at?
Yeah.
And how much time could you spend with me? Maybe there's another practitioner in the office who can spend 45 minutes or an hour, or over the course of 2 visits.
And what you'd said earlier, Dr. Pam, about writing things down, do them in bullet points instead of a novel, because the doctor's going to look at the bullet points. If you start writing, on Monday morning I got up, I had, I brushed my teeth, I went out and got the paper, and you just do it in a novel form.
And then Mom got lost on the way to the supermarket. Just
do the bullet points.
Bullet points, absolutely.
It's reader friendly. But share that information with the provider and let them know what's going on, because it's so very important.
Right.
It really is.
So one of the things that I want to definitely touch on is, how early do you address this with your doctor? Because I know that, like so many out there, or maybe I'm very unique, but I don't think that I am, you don't want to acknowledge that it's happening to your mom, to your dad, to your loved one. So you do make excuses for the behavior. And I know that we've talked about that. You just want to say maybe they're just stressed, they're getting old, or if they're giving you an excuse for why they've done it, or if they are getting adversary with you, you don't want to get adversary back with them. Like if they're, you just want to give them that get out of jail free card and don't want to acknowledge that there is a problem. But you're not doing them any favors if you do that, correct?
Exactly. Suppose your car is going downhill. Do you want to put the brakes on at the top of the hill, or do you want to wait till you're almost to the bottom?
Right.
And skidding out of control. When I first started this 30-some years ago, people didn't come to me until they were really, really confused, disoriented, couldn't get dressed, couldn't live alone. Now folks very wisely are coming early. There's actually a whole diagnosis of mild cognitive impairment, where the family's saying something's wrong, we acknowledge something's wrong, and we can start lifestyle changes, maybe supplements and natural treatments, or the prescription medication to keep them at a level 3 instead of waiting till it gets to a level 6.
Right.
Yeah, and we're talking hospice.
Right.
Later on
at 7.
At 7, we're talking about bringing in supportive care.
Exactly.
And
So
we'll look at each other. I wish they'd have been here a year ago.
Many
and it's
times.
I'll go in her office and close the door, and we look at each other and goes, a year ago we could have made such a big difference.
And in the patient, but also in the family.
The family needed us. They needed us a year ago. We could have really helped them, because they have just been home struggling, and we don't want anyone home struggling anymore. I mean, we really don't.
yeah, because it's a roller coaster wild ride.
It really is.
And it's a ride it's actually a roller coaster wild ride in the dark.
That's a great term.
Yeah,
it really
yes,
is.
it is.
Can I borrow that?
Yeah, absolutely. Absolutely. And I think it's important to not be in the dark, because you really are not doing them any favors. You're not doing yourself any favors. And you will end up looking back and saying, woulda, coulda, shoulda. and there's no do-overs. And it's important, I think, to suck it up and say, you know what, something's wrong with mom, dad. And I will tell you, they can be very obstinate and they don't want to acknowledge that's happening, but you have to force them to go to the doctor.
Tough love.
Yes, you have to kidnap them and put
Janet,
them in the car.
What do you say?
You're doing it for them, not to them. You're doing it for them, not
I'm
to them.
going to steal that from you.
You can have it.
Yes.
Yeah. And guilt is a gift you give yourself. Do not feel guilty for loving someone to get them help and get you some help.
Yeah, it's so important. And I think you can't just, everything we just talked about is just super important for caregivers and for, children of potential dementia or Alzheimer's patients that are just, they don't know what to do, and it scares them because they still see mom and dad as, I want to come home and get snuggly at Christmas and have mom and dad make me, have cookies and during the holidays, and that's still their safe spot. I mean, you have that unconditional love with your parents, and it doesn't matter how old you get, you still have it, and you don't want to acknowledge that something is wrong to that extent, because it's totally different than even when I think you have a parent with a disease. Because my mom died of cancer, but she never had any kind of memory loss, or her personality didn't change. So it was different because you don't, like, my dad did. I'm like, who are you? That was not my dad. He disappeared. And literally in the eyes, literally you could look in his eyes, and it just, you didn't connect. It was very strange.
Well, and with the dementia, it's a gradual. You lose them gradually, and and it's so sad to see that happen, and it's sad for us too. I mean, I cry. We cry in the office too. But to see that gradual losing your parent or your loved one gradually. And it's heartbreaking. The disease takes over, and it is a gradual thing.
Yeah, especially when they do have those anger outbursts, because to understand it's the disease, it's not the person. That can be very, very difficult.
Yeah, because they're pushing you away, and sometimes we've seen 3 family members saying, well, I'm not going to go back and pitch in because of the mean things they said to me and my kids. But it wasn't them saying it. It was the disease saying it.
Yeah. Exactly. Yeah, I mean, my dad, I would be like going, what is wrong with you? Why are you being, and I'm thinking, why are you being such a jerk? And then and that was before even I realized what was really happening. And I'm thinking something is going on here, and it was a tell sign looking back. But like we've talked about, hindsight is 20/20. So real quick before we wrap up, so medications that don't work or they only work for about 2 years.
That is a misperception.
Okay.
We have medications. I thank God for them every day because, again, I had nothing 30 years ago. And now we're using these medications that seem to help with the behavior, with some of the focus and concentration. But what you just said is something we've heard, that the families will say, well, I saw on the internet they only work for 2 years. Well, that's because when they tested these, they followed the people for 2 years so they could document 2 years. But we keep people on these for years because they, as long as they seem to be helping, we use them.
Because you want to have a better quality of life as long as you can.
Yeah. And it may just be maintaining the person, whether it be maintaining the behavior, maintaining the memory loss to keep it from plunging. So it may just be maintaining. It's not going to cure. You're not going to get your dad back or your grandmother back or whomever. You're not going to get them back to where they were years ago, but it may just be maintaining that loss at a slower pace.
So that they can still live at home with help instead of being in an assisted living, or they can still stay in the assisted living rather than go to a nursing home.
Memory care site. Yeah, absolutely. Well, thank you so much, ladies. This was really informative and such an interesting and intricate subject that I think is very important to a lot of folks. So I really appreciate your time today. So
thank you.
That's another episode. Thank you, everyone, for joining us.